Today I'm going to discuss about primary hyperparathyroidism. So I'm Dr. Nigatu, internist. So primary hyperparathyroidism is anatomy autonomous overproduction of the parathyroid hormone resulting in hypercalcemia. This can be from either of the four lobes. So parathyroid hormone hasn't already four lobes, so it can be either of the four or it can be four of them that result in overproduction. So the commonest cause for this is parathyroid hyperplasia, adenoma, which is it is the commonest cause is adenoma. So it is account for 80 to 85, which is usually single lobe, and the second cause, which is account for 10 to 15% is hyperplasia, that accounts for 10 to 50%, and usually it is multi-lobe. And the second cause, the other cause is carcinoma, parathyroid carcinoma, which is less than 1%, and extremely rare is genetic cause, which is called Mann syndrome, Mann 1 and Mann 2A. So clinical presentation can be the site of involvement. It can be stone, it can be bone involvement, or it can be abdominal organs, or it can be neuropsychiatric tones. So on the renal we have renal stone due to increased reabsorption. Usually the pathophysiology, we discuss about the pathophysiology. Actually, we have to discuss the pathophysiology before the symptom. So there is increased production of parathyroid hormone. This results in increased bone resorption, results in hypercalcemia, and there is increased renal tubular reabsorption of calcium. It also increased hypercalcemia. Decreased reabsorption of renal reabsorption of phosphate results in hypophosphatemia. And there is also increased activation of vitamin D. So vitamin D can be mildly elevated or normal. So on renal stone we'll have nephrolithiasis, nephrocalcinosis, and polyuria polydysmia. And on skeletal bone we have bone pain, osteoporosis, or there is a so-called osteitis fibromas cystica. And on gastrointestinal system we'll have this nausea, vomiting, pancreatitis, constipation, and peptic ulcer disease, because hypercalcemia results in peptic ulcer disease. And on neuropsychiatry they will have fatigue, depression, confusion, and they will have also cognitive dysfunction. So on cardiovascular we will have this hypertension, arrhythmia, and QT prolongation. So on the laboratory we will have hyperparathyroidism. There is a parathyroid hormone will be increased, the calcium level will be increased, 24-hour urine calcium will be also increased, and the phosphate level will be decreased. So on ultrasound we'll have renal stone as manifestation of abdominal ultrasound, and on the neck ultrasound we will have for localization we'll have this ultrasound, and on scan there are different types of scans. So on the T scans we'll confirm the locations of the hyperfunctioning adenoma, and the other for the osteoporosis we'll have DEXA scan and like that. And so the management is usually the most common. The management is surgical, more than 25, almost in the most cases it is curative, but there should be indication for the surgical removal of this parathyroid hormone, parathyroidectomy. So they should be symptomatic, either the renal stone or the other symptom, hypertension, hypercalcemia, and other hypercalcemia, especially greater than 1 milligram per DL above the upper normal limit, and is symptomatic age less than 15, and the renal stone, and the other indications. So osteoporosis, renal dysfunction, like that. So medical treatment when there is no indication for surgical treatment. So adhesion is the most important, and with a non-surgical patient. and avoid hazardous and lithium and cinacalcet, which is calcium mimetic, is important for suppression of this parathyroid hormone, cinacalcet. Bisphosphonate or denosumab is also important for bone protection, and monitoring calcium and parathyroid hormone level is very important. So, in short, primary hyperparathyroidism means this. Post-operatively, we have to monitor for parathyroid hormone and calcium level, and there is a so-called transient hypocalcemia, which is called Hungary bone syndrome. This is due to the removal of the low, and the result is in low calcium level. So in this case, we supplement calcium with vitamin D, that's important for treatment of this Hungary bone syndrome. So thank you very much. If you like, so like, comment and share this video to reach many of your friends and your family. Thank you very much. Thank you.